Hello, everyone, and welcome to Stepping into the World of Virtual. I'm sorry. Welcome to Stepping into the World of Dementia. For those of you who are joining us for the very first time, we are so glad to have you here. Um, we are hosting a 10-week Stepping into the World of Dementia tour. And if you missed any of the weeks, you have missed a treat. You have missed a treat. It has been a wealth of information that has been presented by various professionals that are very beneficial to caregivers, especially those who are taking care of loved ones suffering from dementia. Today's session is dealing with occupational therapy. And did you know that occupational therapy can help to improve the quality of life of your loved one? Today we have Emily Bourland, who is an occupational therapist, and she is very passionate about occupational therapy. And she is going to provide some helpful information for us that will give us a better understanding about occupational therapy, how it can really benefit your loved one, whether you're just taking care of a senior loved one or somebody who's suffering from dementia. So, at this particular time, I would like to introduce to you Emily Bourland. And she is going to let us know a little bit more about her before she goes into the presentation. Welcome, Emily.
Hi, thanks so much for having me here, Tamaria. I'm always thrilled to have the opportunity to advocate for caregivers, of course, and also to provide some education about my profession, which is occupational therapy. Because as you and I were just discussing right before we got started here, it is unfortunately poorly understood. It's not well known. I always like to say to people, you probably have seen an occupational therapist or one of your loved ones has worked with. If you have been in the healthcare system, I guarantee an occupational therapist at one point or another has touched your life or your loved one's life. But maybe you didn't know it. We're often mistaken for physical therapists, sometimes even nurses. So I'm really excited to be here today and talk about specifically the experience of people with dementia and caregivers of of dementia, and how occupational therapy kind of works to help improve the quality of life for both people in the care relationship and the care partnership, and ways that you can try to access occupational therapists. So if you don't mind, go ahead and pulling up the slides for me. Okay, all right. So here we go. And I promise I'm not going to death by PowerPoint you. This is more to keep me on track, because I could go all over the place talking about this stuff. I love it so much. So I have some slides here just to keep me on track, and hopefully to help, guide any conversations. If there are any questions that come up in the chat or anything during this, I don't know how much, Tamaria, I don't know how much you can see. Sometimes it's challenging when you're live streaming on multiple platforms. But if you see any questions that come up, just interrupt me. I'm the least important person here. The most important people are people who are watching who might have questions. So just interrupt me whenever. So as Tamara said, my name is Emilia Bourland. I'm an occupational therapist. Little bit about my background. In addition to being a licensed occupational therapist for over 10 years, I also have my executive certificate in home modification from USC's Leonard Davis School of Gerontology. I am the instructor, founder, and owner at Higher Standards Caregiver Training. I have worked during the course of my clinical career, which has been, I've worked everywhere from memory care and skilled nursing all the way to, rehab, acute care, and the ICU. And of course, folks with dementia are in all of those areas receiving care. I've worked with literally thousands of patients, thousands of caregivers. And I have had the privilege during that time to also provide training and education to caregivers, even to nurses, and even to fellow therapists during my clinical work. I've worked as an educator at Texas Women's University, where I taught hands-on skills and clinical skills to Master of Occupational Therapy students. And of course, education is my passion at Higher Standards Caregiver Training as well. And in addition to that, I am a published author. So, little quick disclaimer before we go down this yellow brick road here. This is for educational purposes only. It's not a substitute for a therapeutic relationship or health or medical advice. So if anything that I say reminds you of someone you know or a loved one, and you think maybe that person needs to be seen or treated by a licensed healthcare provider, then please make sure you're advocating for that person to get that assessment or appointment or treatment, whatever it is that they need, because this is for educational purposes only. Okay, so I know I'm supposed to be talking about occupational therapy, but the fact is, what I do as an occupational therapist and what other occupational therapists do is only relevant to you in terms of your experience, right? Like, we're here for you as caregivers and, or possibly as someone who is experiencing dementia themselves. We're here for you, not the other way around. So I just wanted to start by kind of acknowledging some of the challenges that caregivers of folks with dementia often face. So certainly there are physical challenges, especially as people need more advanced care. It can be physically difficult to do, and there are physical risks of injury, both to yourself and to your loved one. Being a caregiver is mentally exhausting. If you're on this call right now, or if you're watching a recording later, that's probably not news to you. You have so many things on your plate: tracking appointments, dealing with medication management, of course, all of the care duties that you have, both physical, cognitive, and mental. And then you have the rest of your life too. Maybe you have work, maybe you have kids that you're caring for. You have other things that you have to do and other obligations. So it can be really mentally exhausting, just kind of holding all of that together, right? And then along with all of that comes the emotional stress as well, right? The stress of meeting someone else's emotional needs. That can take a lot of our energy to do that, right? To meet someone else's emotional needs. The family dynamics that are at play when we are caring for a loved one. And, along with that, maybe your own unmet emotional needs during that time. So occupational therapists can help you with all three of these kinds of common challenges. And we really are an important resource to keep in mind to help deal with the physical, mental, and emotional challenges of caring for someone with dementia. The primary ways that we're going to accomplish that is through training for you as a caregiver and therapy for your loved one. And don't worry, I'm going to talk a little bit more about kind of what that means. Let's take a step back first and kind of just define what occupational therapy is, because like I said, it is often a misunderstood or misinterpreted field. I will say first, you don't have to have a job to get occupational therapy. Our role, occupational therapists are licensed healthcare providers, and our role is to help people do the things that they need to do, want to do, or have to do. And that can be literally anything under the sun that you need to do, want to do, or have to do. Of course, we all know that sometimes there are barriers that get in front of people being able to actually accomplish the things that they need to do, want to do, or have to do. Those barriers can be physical, cognitive, emotional, mental, societal. They can have to do with the environment that is around the person. It may have to do with the demands of the activity or the task or the occupation itself. So therapists, occupational therapists, help people to do the things that they want to do, need to do, and have to do by addressing the physical, cognitive, that's a new one. Put it in the dictionary. The physical, cognitive, and emotional and mental aspects of the person themselves who has that challenge, and how those characteristics impact function. So we try to address those issues. We also are looking at the environment and how the environment around that person is impacting their ability to function. I'm sure we've all had an experience. This is a really simple example. if an item is on a shelf that's too high for you to reach, then maybe you can't use that item, or you have to find a different way to get up to that item on the shelf, right? Versus if an item is right there in front of you on the counter, it becomes very easy to work with. So that's kind of a simple example of how the environment can influence function. And occupational therapists are looking at that big picture as well. And then, of course, we're looking at the activity itself. What are the demands of the activity? What does someone have to be able to do in order to accomplish this? And how can we adjust or adapt the activity in order to make it so someone can participate in it? Occupational therapists treat people from literally every age group. There are occupational therapists in the NICU. There are occupational therapists, as I said, all the way up to the ICU, helping to provide end-of-life care, etc. So we're there helping people from every walk of life, every age group, with just about any challenge or condition that you can think of. So it's a huge scope of practice. Obviously, we're going to look at just a slice of that today. So how do occupational therapists work with people who have dementia? And I'll just tell you, working with folks who have dementia is one of my passions as an occupational therapist. I feel so fortunate to have the ability to have that interaction with people and to be helpful at that moment in life. It's something that's very joyful for me to do. So I speak about this, from a perspective of someone who loves working with people who have dementia, and someone who's passionate about improving the quality of their lives and the lives of the people who are caring for them, because these two things go together, right? They are connected. They're not separate. So occupational therapists might work with someone who has dementia by helping them to maintain their participation and their independence for as long as possible. They might work with someone by helping to prevent injuries or falls from occurring, to prevent unnecessary decline. So sometimes people decline more quickly than they have to, and occupational therapists can help to prevent those unnecessary declines from happening more quickly. And of course, we're working to provide the highest possible quality of life for people. We do that in lots of different ways, but I kind of pared it down to 4 basic ones here for the sake of time for this presentation. One of the most important things that we do for folks who have dementia is we help therapeutically, if I'm working directly one-on-one with someone who has dementia, is skill practice. Just like for you, if you don't do something for a long time, let's say it's riding a bike. They say you never forget how to ride a bike. But I actually did really struggle to ride a bike again after several years of not riding one. I mean, I picked it up pretty fast, but point being, if you don't do something for a long time, you get rusty at it, right? So one of the most important things that occupational therapists will do for folks with dementia is to help them maintain that skill practice. So they are continuing to participate, and the longer they continue to participate, the longer they can continue to participate, if that makes sense. Often we will also change the requirements of the task that the person with dementia is trying to do. So it's not uncommon for people with dementia to, for example, start to have more difficulty feeding themselves or start to eat less during mealtime. And that's for a variety of reasons. But one of the things that occupational therapists can do is sort of change the parameters of that eating task in order to help someone with dementia be more successful actually feeding themselves and eating enough. Certainly modifying the environment to support safety and to support participation for people is really, really important in folks, in everyone, but particularly for folks who have dementia. We need to think very intentionally about how the environment is arranged for that person to make sure we are giving them the best set of tools around them and the best environment possible around them to keep them functioning for as long as possible and to prevent injuries from occurring. So we do a lot of environmental modification. And of course, the other really important thing that occupational therapists do, our primary goal is to support quality of life through meaningful activity in things that people value. So often as people progress from one stage of dementia to another, it might become harder for them to participate in the things that they used to once do. So an occupational therapist can come in, look at the demands of the activity, look at where that person is in their dementia process and in that journey, and can find ways for them to still be able to have some level of participation in the things that they found meaningful. And that can be really beneficial, of course, in terms of like someone maintaining their skill set for as long as possible, in terms of their quality of life. But it can also prevent some common kind of challenges and pitfalls that happen when we're caring for folks with dementia as well. And this is a bit separate. Sometimes these things happen at the same time and sometimes they don't, but this is the other important part of the equation, right? Obviously, if you have a loved one who is receiving therapy from an occupational therapist, then they're working, directly one-on-one with that person. But also, it's really important to understand how occupational therapists are working with caregivers of people with dementia in order to help make your life easier, because that is really, really important too. In fact, it is just as important as providing the services to the person who has dementia. So one of the things that's really important to do is to provide training in care techniques. So my job as an occupational therapist is to pass along as much as possible the information, the knowledge that I have that makes it easier for me to step in and provide care for someone with dementia, to pass that knowledge along to you, whether those are, physical skills that you need to know in order to transfer someone, in order to maybe give someone a bed bath, in order to prevent wounds or prevent falls. But also it can be things like, again, going back to the feeding example, tips for how you can actually help someone eat more independently. So the more education that you can get from the occupational therapist, the easier that's going to make your job as the caregiver, and the safer you can be as well. Occupational therapists should also be providing education on the disease and the process of that disease to caregivers, to help you understand sort of what's going on now, what you might be able to expect, or what you might expect later, and how you're going to plan ahead for that process, and helping you plan for that process. They're going to make recommendations for environmental modifications, or perhaps even durable medical equipment that can enhance the safety of both the person that you're caring for, but also yourself. And they can help recommend additional resources for areas where maybe they aren't able to assist you as well. I wanted to give a couple of specific examples here, just to because I think all of this can sound sort of like up in the air. It's nice to have a couple, an abstract. It's nice to have a couple of specific examples to talk through. So let's say, for example, an 89, and these aren't specific people. This is kind of, just, these are very common examples of situations that I've worked with or seen. So let's say there's an 89-year-old woman who has advanced dementia. She's bedbound or chair-bound, so she's not able to get up and walk around on her own anymore. She's not able to mobilize herself really anymore. She's nonverbal, so maybe she's not able to speak anymore. And her hands are clenched kind of tight like this, and she won't allow them to be open for cleaning. And often that can appear painful. And this is a quite common scenario that often you might see for someone as they are getting into more advanced stages of dementia. As they might lose their mobility, they might lose their ability to communicate verbally. Doesn't mean they can't still try to communicate with you, right? But they might not be able to do that verbally. And often people will kind of curl in on themselves and they'll get these really tight fists that can present some challenges, obviously, for cleaning in the hand, but also some risks for things like wounds developing in the palm. So an occupational therapist in that scenario might come in and provide both do this with the actual person who has dementia, but also teach the caregiver at the same time, teach you how to safely open that hand, making sure that you're not accidentally causing an injury. I will say I have worked with an unfortunate number of folks who I've been called in to take a look at their hands because they're swelling or the hand is painful. And it's really easy to injure someone's hand, particularly if maybe they have arthritis or they're just older, because there are a lot of very delicate structures in there. So we want to make sure that if we are when we're trying to open that hand, because do have to open it to get in there and clean. When we're trying to open the hand, that we're doing it safely for people. So the occupational therapist would go in, teach you methods to safely open the hand, demonstrate it, actually do it, clean in the palm, and then they might even recommend some specific strategies or some specific equipment to help keep that hand a little bit more open comfortably, so that you're not having to worry about fingernails digging into the palms or wounds being caused just from skin breakdown in there from it not being able to be cleaned. So that's one kind of specific example. Another example, let's say you have a 78-year-old man who has kind of mid-stage dementia. And I should acknowledge here, of course, that dementia is more of a term that about symptoms. There are over 400 kinds of dementia that have been identified. So not every kind of dementia is going to look the same or be treated the same. And I just kind of want to acknowledge that here. But let's say, so you have a gentleman who has mid-stage dementia and he's not eating enough. He's not feeding himself. He's having more incontinence and he's agitated and wandering. So an occupational therapist in this situation, whereas the goal for the woman whose hands were clenched was more a prevention of wounds and a hygiene issue and a pain management issue, right? We're dealing with those things. For this gentleman, he's dealing with different issues right now. So it's an issue of nutrition and being able to feed himself, an incontinence issue, and then, a safety issue in terms of agitation and wandering. So an occupational therapist in that scenario might come in and help determine what the best techniques are going to be for that person based on them and the stage they're at and how they would normally operate, to help get them to feed themselves better. They might assist with the incontinence issue in terms of helping to set up a bladder program or a bowel program, to help reduce that incontinence as much as possible. They may also help that person to be able to toilet a little bit more independently again, or continue to participate in toileting a little bit better. And of course, teach the caregiver about those skills as well. And then often if someone is agitated and wandering, I'll also try to put a program in place that really reflects on the things that were meaningful to that person and helps them to engage in some level of that task or some kind of task or activity that is going to be meaningfully occupying to them. When we're talking about what that means for someone with dementia, that the scope of that could be really large. Let's say if you have an ex-teacher who is really only like having mild dementia, or she's kind of in this more moderate stage of dementia, giving her papers to grade might be a great meaningful activity, right? On the other hand, as people go towards more advanced dementia, often just having something like a weighted baby, like a weighted doll, not not a real baby, like a weighted doll or a weighted warm stuffed animal or something like that, something to stroke. Often folding things, it depends so much on the person and where they're at and who they are. Never forget that it's always ultimately about who this person is right now, as well as who they were in their past, to find whatever that activity is, to keep them meaningfully occupied, to help decrease that wandering, decrease that agitation. Hopefully that all makes sense. Please interrupt me if it doesn't. So the next question, the next kind of natural question to help you guys sort of pare this down into useful information for you. Those were examples. You don't have to remember any of that, right? Because it's not your job. It's the occupational therapist's job to come and figure that out. Those are just kind of examples. But when might your person that you are caring for with dementia benefit from treatment with an occupational therapist? So certainly if the person that you're caring for is needing more assistance with their activities, so these could be activities of daily living, like going to the restroom, getting dressed, eating, brushing their teeth, grooming, all of those kinds of things. If they're needing more assistance with those types of activities, or if they're needing more assistance with their walking or mobility, or even their transfers, anytime you're noticing that someone is needing more assistance, that's a great time to have an occupational therapist come in. And at the very least, do an evaluation and let you know, okay, is this something that is a natural part of the disease process and there's probably not a whole lot I can do about it? Or is this something where I think I can be effective and make this easier or better for you? Just having that evaluation is worthwhile in those situations. If the person that you're caring for seems less steady, or if they have fallen, that is absolutely an indication for an occupational therapist to do an evaluation. If the person that you're caring for is frequently agitated or wandering, I would definitely, if this were me and my own family, because I can't treat my own family, I would want an occupational therapist to come and do an evaluation in that situation to help me better manage and to help keep them meaningfully occupied. If the person that you're caring for cannot safely access all of the areas of the home that they need to get access to, then absolutely that is a good reason to have an occupational therapist do an evaluation, particularly if that occupational therapist works in home modifications. And I am going to share with you a resource where you can find one of those here coming up in just a second. Or if you just see last kind of indication, if you see the person that you're caring for is just generally declining, it's not a bad idea to have an occupational therapist come in and do an evaluation. They will sit down with you. They will ask in detail, or they should ask in detail about how things are going, what you're struggling with, what the person you're caring for is struggling with, what's hard, what's easy, how does this fit into your life? How does it not fit into your life? And come up with a plan specifically to help you with those challenges. I should note here, if your loved one is showing a sudden decline, or you're concerned that there's a medical status change, something has changed medically for this person. If you ever have that concern, or if the person that you're caring for has a sudden decline, you need to seek medical care from a physician or possibly emergency care. And the reason I say that is because dementia is something that progresses slowly over time. It is not something where people go from having mild dementia to very severe dementia in a day or in a few hours. It's not something where people go from a little confused to extremely confused overnight. I say that having many experiences, having worked with family caregivers or even non-medical professional caregivers, where someone might say, oh, so-and-so, her dementia just got really bad today. Dementia generally doesn't work like that. So again, if you're seeing a sudden significant decline, if someone is suddenly becoming much more confused or they're doing much worse, That's an indication that there might be something else going on with them medically that's an issue that needs to be dealt with. So definitely call your doctor about that, okay? Okay, so here's where the rubber really meets the road, right? How can you actually access occupational therapy treatment for your loved one? There's some different common ways that you can do this. One is through your primary care doctor. So ask your loved one's primary healthcare provider to write an order for occupational therapy. If you are seeing these kinds of declines, if you're seeing issues, then you can simply ask your primary care doctor to write an order for occupational therapy. That might be in an outpatient basis. Often it's for home health to come out with occupational therapy, but you can ask your primary care doctor for occupational therapy. I will say the more that you can share about the specific functional challenges or safety issues that you're facing, the more likely you will be to be successful with your request. But that's one of the things you can do is you can simply ask the primary care provider for your loved one that you're caring for to write an order for occupational therapy. Another common time that people will receive occupational therapy is if they're in the hospital, and certainly if they're in rehab. If they're in rehab, they're almost certainly will be seeing an occupational therapist. In the hospital, they may or may not see an occupational therapist, but you can make that request if you think that it's something that would be beneficial. And I always recommend, well, I mean, not universally, but it can often be a good idea. And you kind of have to think about the circumstances and make the best judgment for yourself. But it's often a good idea to request home health occupational therapy after if your loved one is being discharged from the hospital or if they're being discharged from rehab. A lot of times, if they are being seen by an occupational therapist in those settings, then the occupational therapist should communicate with you about that, making that recommendation. And if they think that recommendation is necessary, they're going to go ahead and recommend it. But there's no guarantee, there's no guarantee you're necessarily going to have an occupational therapist in a hospital setting. So it's always a good idea to at least have a conversation about whether or not someone would benefit from having an occupational therapist come out with home health so they can see the person that you're caring for in the actual environment that person lives in. There's pretty much no substitute for seeing someone in their actual home environment, particularly when we're talking about folks with dementia. So advocating to get an occupational therapist out to you in your home can be a really powerful tool that you have. There are also private therapy options. And often these can be the quickest and easiest to access because you can just call the occupational therapist directly. You can do a web search for local occupational therapists, call around for people who are in private practice and see if you can get them to come out and do a visit. And of course, that person can advise you as to what they need in terms of orders from a doctor or whatever they need. And that might vary by state. Each state has different licensing laws. So I'm not telling you that because you need to worry about that. I'm just letting you know the occupational therapist will walk you through whatever the process is, wherever you are. If you are specifically needing an occupational therapist to do a home safety assessment or home modification specifically, then I really recommend this great website. You can search for an occupational therapist who specializes in those things. Of course, if you have an occupational therapist coming out for home health, there's a good chance they're probably going to be looking at the house. They're going to be looking at general safety issues. They might be able to make some simple recommendations. But sometimes the scope of services that a home health therapist can provide can also be limited by the time frame that they're allowed to treat you in terms of how many visits they get, and by the payer. So sometimes, and of course, that person may or may not specialize in home modifications. So if you need someone, if you have a situation where you think you really need a skilled person to be out there looking at the home, helping you plan, helping you to think big picture about how that space can work, or needs to work, then having an occupational therapist who specializes in home modifications is a great resource to have. And you can find those, you can specifically look for those people in your area at www. Oh, that's wrong actually. It's hmota.net. I've got it right on the next page. Don't worry, this isn't the only place there.
Amelia,
Yeah.
you have a question in the chat.
Okay.
I think you kind of answered it a little bit pertaining to the modifications, but it says, does occupational health work with Medicaid and or Medicare? How much service can a person receive using these insurance sources?
So that is a really great question. The answer is it depends. So sometimes I'm going to break that up into some different parts. If you have, say, a home health therapist in your home doing like a general safety assessment, generally that's something that is going to be paid for, that is usually paid for by insurance or by Medicare. I can't promise that or guarantee that. It depends very specifically on the situation. If you're talking about the actual modifications to the home itself, then unfortunately, that is usually not something that Medicare or Medicaid will fund. So if you're thinking about grab bar installation, widening doorways, putting in a curbless or roll-in shower, putting in a ceiling lift, these kinds, any kind of modification like that, and of course there are many, but those are just a few examples, then that is generally not something that Medicare or Medicaid covers. They also, and again, it very much depends on the circumstances. I encourage you to ask for these things and advocate for these things. If they say no, they say no, but ask for it and advocate for it. But a lot of times doing a significant home modification assessment, where you're going in and you are really looking at everything with purely the environment and those modifications and the specific person in the environment in mind, that kind of assessment may not be covered by Medicaid or Medicare. It really just depends. So again, I encourage you to advocate for that and ask for it, and then, move forward based on kind of the answer that you get there. I wish that there were direct insurance funding for home modifications, but for most folks, unfortunately, they're not. What I will say is that doesn't mean that there aren't resources out there that you can use to help fund modifications. So a great place to start is your local area agency on aging. They get grants to help support many different things, but caregivers and caregiving services, or caregiver support is one of those things. And often they may have funding to help with simple home modifications, or if they don't, they will usually know a resource to direct you to where you can find a place that has funding to help provide home modifications if it's something that's out of reach financially for you in your situation. Another great organization. Oh, and let me say real fast, if you want more information on how to find your local area agency on aging or how it works, I recently did an interview on my podcast, which is called The Caregiver's Dilemma. Look that up, and I want you to search for the episode with Donnie Green. I want to say the name of that episode is like the best resource ever or something like that. If you don't mind, I'm gonna look it up real fast so I can actually direct you appropriately. Sorry, dead air. Okay, I'm under the gun. It's too much pressure. I can't find it. I tell you what, I will find a link to that episode, and then can I share it with you, Tamaria, so that you can post it?
Yes, you can just share it with me.
Okay, because Donnie Green, the guest on that episode, She is a wealth of knowledge about caregiver resources. So highly recommend listening to that. So your area agencies on aging is a great place to start to find those resources. There's a national organization called Rebuilding Together, and they have local chapters in a lot of major cities. I don't know exactly how many, but it's worth looking them up. And they will often provide home modifications at no cost. And they usually work with occupational therapists. So I've done a fair amount of work with Rebuilding Together here in Dallas to go out and do the assessment, make the recommendations, and then Rebuilding Together will come in and they will provide that modification. Of course, there's a wait list for a lot of these things that happen that you can get for free, but it is a resource that's out there. I wanted to say, those are probably the two places that I would start. Community independent living centers too. And again, you can just like Google community independent living center, and those places will also often have resources that they can direct you to help provide funding for it's usually relatively small home modifications, but even a small thing can make a huge difference for someone if it's done correctly. Oh, I know. The last resource I was going to share is if you are a veteran and you are connected with the VA, then the VA has lots of different programs where they actually will help fund significant home modifications. That all depends on your service connection and your VA benefits, etc. But it is worth looking into if you are a veteran, because the VA is one of the very few healthcare organizations that can provide, some really, really fantastic home modifications. That's how I got into home modifications in the first place, is actually working at the VA and helping to make those recommendations for veterans. So I hope that was a very long answer. I'm sorry. I hope that answered the question though. Okay, so when kind of get back to the slides, when might you as a caregiver benefit from training from an occupational therapist? If the person that you're caring for needs more physical assistance, you would also benefit from training. If you are worried that you are not doing things safely or the quote unquote right way, then you would benefit from training with an occupational therapist. If you have back problems, if you've hurt your back, if you've worried about hurting your back while caring for someone, again, you would also benefit from that training. If you have medical equipment that you're not sure how to use or you're not comfortable using, this is very, very common. People get discharged from the hospital or rehab with equipment that they don't know how to use or they're not comfortable using. If you have just questions about how to care for someone with dementia and related illnesses safely, that's a great time. And if you're just having trouble managing behaviors or emotions for the person that you are caring for, again, training from an occupational therapist would likely be beneficial in those contexts. How do you access an occupational therapist to train you? So traditionally, really the only way for you to get direct access to an occupational therapist to train you on caring for a loved one traditionally is if your loved one is being treated by an occupational therapist. So that would mean that your loved one has to actually qualify for treatment from an occupational therapist. They have to have an issue going on that we can actually help with. And in that case, if your loved one is being treated by an occupational therapist, you want to make sure that you're getting training, including like during that treatment process. The real bummer about this is that, unfortunately, our healthcare system really doesn't send occupational therapists only for the purpose of training caregivers. Our primary role, based on the way our healthcare system works, the way our payment system works, is that we're there to see the person with the disease or the injury. We are not there for the family caregivers. So caregiver training might be part of a care plan, but it's sort of incidental to what we're there to do for that patient. I wish that's not the way it was, but unfortunately it is. However, you can still access hands-on training from an occupational therapist if you going through a private practice or a private pay occupational therapist. That's one way. The other way is what I have basically created through Higher Standards Caregiver Training, which is my company, and it's an alternative way for you to access the same kind of education and skills training, like practical skills training, that an occupational therapist might teach you in person, but through online programming. And the reason that I have it set up that way is basically to make it easy for family caregivers to access that kind of training and information, because it can unfortunately be very difficult to get time with an occupational therapist as a caregiver, because it's really not funded for us to be out there just going out doing caregiver training, unfortunately. So Higher Standards Caregiver Training is really all about having a very easily accessible, very cost-effective solution to get training on issues that you are seeing, based on my knowledge as an occupational therapist, when you need it. I should say it's not the courses at Higher Standards Caregiver Training are not therapy. They are education for you as a caregiver. But that's a resource that I've created just because y'all need more info, right? You need more resources. And the easier we can make it for you, the better, the safer, the happier you will be. And that makes your loved one better, safer and happier too, right? These things are connected. Your quality of life and the quality of life of the person you're caring for, they are connected. We need to think about both. So you can find out more about occupational therapy. If I have been utterly confusing, my deepest apologies. You can find out more about occupational therapy from the American Occupational Therapy Association at aota.org. You can find more about occupational therapy in home modification, and you can search for occupational therapists in your area that do home modifications at the Home Modification Occupational Therapy Alliance. That's hmota.net. .net, not org. Sorry, I messed it up on the other one. hmota.net. And you can find more information at your state occupational therapy licensing boards and associations. If you just Google occupational therapy Texas, occupational therapy California, occupational therapy Washington, you'll be very likely to pull up those kind of state boards and resources. So you can find out more there as well. There's my contact information. Feel free to reach out if you have questions. If I have been utterly confusing, I'm so sorry. And of course, there's the website for Higher Standards caregivertraining.com, where you can access those courses that I was talking about. I talked forever. I'm so sorry that went so long. Tamario, did anything else come through in the chat?
No. Well, the last thing was great information, very informative. Thank you.
Okay, great. That's awesome. Thank you for that feedback.
All right. Well, thank you, Emily. I enjoyed this session. I'm sure as others have as well. There were a lot of things that I did not know when you were talking about helping to improve some of the behaviors that one may experience when suffering from dementia, such as agitation, wandering. I never knew occupational therapists help in that area. And I'm sure you know that many caregivers who are taking care of loved ones suffering from dementia, that's one of the problems that they encounter on a daily basis, is how do I handle the agitation or the aggression or frustration that my loved one is dealing with? Could you briefly kind of elaborate maybe a specific example on how an occupational would address someone who's agitated or whatever? Can kind of elaborate on that?
Yeah. So I think that's a great question. And yeah, I would say that that's the number one thing that people have concerns or complaints or issues about a lot of times, or that's the very first thing that they talk about. And then, once we start talking about what's going on, then there are all kinds of other like issues that we can get into and challenges to talk through. But issues with agitation, aggression, and wandering are like top of the list for both family caregivers and frankly non-medical caregivers who are handling a lot of these situations as well. So the idea is basically, people with dementia are still people first, right? Agitation is a normal human emotion. It's a response to the things that are going on around us. And the need to be occupied is a normal human thing too, right? I'm sure we can all think of examples in our own life where we were bored and we started wandering around the house. Or we had kind of maybe lost a role that we used to have. Maybe we retired, or maybe, we stopped volunteering or something like that. And it leaves a gap in our lives. And that has a negative effect on us mentally a lot of the time. So people with dementia are not necessarily any different than that. But of course, it can be significantly more challenging to find the activity or the occupation, whatever you want to call it, to kind of fit in that slot based on their skill set. So again, I think that the example with the teacher is a good one. Let's say you have a teacher who she was a teacher for 30 or 40 years and now she has dementia. Maybe she's starting to get pretty confused. She's wandering around. She's looking for something to do, right? So what can we think about in terms of her background and her as a person, not her as a diagnosis, but her as a person that would be meaningful to keep her occupied? Well, let's see if we can set her up with some papers to grade. They don't have to be real papers to grade, but let's set her up with some papers to grade. Right. It is really, and then, she's meaningfully occupied. It helps to keep her focused so she's not wandering. And in general, the more that we can be meaningfully occupied, the better sort of emotional regulation we have too. It is really important to note that finding that just right fit for someone in terms of the activity is important, because if we're giving someone with dementia something that is too hard for them, they are going to become agitated. Right. Like, I can't do calculus. I can't do OChem. That's not my thing. If you put that in front of me over and over again and you ask me to do that, I'm going to get ticked off. And agitated. Right. Yes. So we have to be mindful of, and a lot of times this can be challenging to do, because we want, it's easy as a professional to say this, but let's just acknowledge that when it's your loved one, it's a lot harder to say, well, my mom can't do that anymore, and I have to accept that. That's not easy to do. Right. So there can be kind of an underlying desire sometimes for us as caregivers, as family caregivers, to want that person to keep doing it the same way they used to. Or, hey, mom, remember when? Oh, who is that? You remember who? To like try and push them to keep holding on to those things. And but at a certain point they can't. Right. So if we're asking them to do something that's too challenging for them, they're going to become agitated, right? Just like you or I would be. So, the occupational therapist is going to step in and say, okay, well, let's look at what skills this person does have. Let's look at what they used to do. Let's see how we can make these meet. Let's make it simpler. Let's reduce the steps. Let's whatever it is to make that something that is a positive experience for that person. Because at the end of the day, when we're caring for folks with dementia, the end goal is not to make this person the person they were before. Unfortunately, we don't have the capacity medically to make that happen yet. The goal is to give this person the best quality of every moment of their life that they have. Because one of the, and you can dementia is so hard. It's so hard. And like, feel all the feelings about it. Feel all of the feelings. But one of the things that can come from it that you can view as a blessing is this ability to be in that moment.
Right.
Because the person with dementia is just in that moment.
Mm-hmm.
And so we want to make that moment good.
Right.
Just because they don't remember it 5 minutes from now doesn't mean it doesn't matter, because they still will have experienced it. Do you know what I'm saying? And the more it does take a little bit more effort at first. It does take a little bit more thought. You know, you may have to call in a professional to do these things. But the more we can focus on making those moments positive, then we're not seeing the wandering, we're not seeing the agitation, we're not seeing the aggression. I'm not saying that we can make those things disappear entirely. And of course, there are types of dementia where people are more prone to aggressive outbursts or agitation. Right. And understanding that is really important. But does that make sense?
Yes, it does. Thank you. Thank you. This was a great session. I learned a lot. If you have any questions, you're watching the replay. Please put the question in the chat box. Message me, message Emilia. Her information is on this video as well. If you have any additional information. The replay will be on Royalty Senior Service Consulting on Facebook as well as YouTube. And as always, I encourage all of you to share these videos. Share these videos with other caregivers. Share these videos with family and friends, because this is great educational information. As she mentioned, like, I learned something. I didn't know that. Like, I just asked the question how occupational therapists can help in addressing the various behaviors. And that's what many caregivers deal with. Like I said, please share this information with others. And also, we're looking at that it helps to improve the quality of life of your loved one, especially if they're suffering from dementia. But also, it helps you as a caregiver as well, because it takes some of that frustration and stress off of you. If the occupational therapist is coming in and working with your loved one and showing you, okay, how to address this, how to address that, that's going to take stress and frustration off of you. And that goes back to the whole point of this tour, stepping into the world of dementia. You have to go into their world. Like she was talking about, they may not remember things 5 minutes from now, but they're enjoying it at their particular time. Go into their world. That's one of the points of this tour, to step into the world of dementia, in addition to obtaining as much information and resources as possible that can help to make your life easier as a caregiver. So we thank you, Emilia, again for joining us.
I'm so sorry. Can I say one last thing? Because sure. I think that, so if what we, especially like this last bit that we were talking about agitation and wandering and all this behavior stuff, if that is something that you are interested in learning more about and kind of getting more into the nitty and gritty on that, as a caregiver, then make sure that you are following me on social media. So probably you can find me on LinkedIn. If you just search for Emilia Bourland, you can find me on, I have a YouTube. What's the best way for, like, should I just send you like my links and then people can follow it from there, or?
Well, people can watch the replay, but also right. I'm going to put it in the chat as well.
Okay. So I'm on Facebook. If you go on Facebook and you search Higher Standards Caregiver Training, or you go to YouTube and you search Higher Standards Caregiver Training, those are easy ways to follow me and the information that I put out. But the real reason I'm saying that is because if you're interested in this kind of more emotional behavioral kind of management part of dementia care, I'm going to be doing a series coming up in the fall that's specifically dedicated to that. And as that information comes out, I'll announce it on my social media. So that way you'll get notified. It's just so you get notified about when that is happening. If that's something that you're interested in kind of getting a little bit more granular and learning a little bit more like strategies than we had time for today. Sorry, I'm so sorry to interrupt your wrap up.
You're fine. You're fine. Thank you again, everyone who's joined us on today. And like I said, the replay videos will be available on YouTube and on Facebook. If you want to go back and watch it and share this information with others as well. It's a Royalty Senior Service Consultant. Thank you again, Emilia. And we hope this information was very helpful to you. There's another message from Kendra Smith said that she enjoyed the session as well. Um, so just continue to watch every week. We have 6 more weeks remaining in the tour, and each week it's just gotten better and better and better and better and better. It's so much great information. Some things that you may not have even thought about as a caregiver, like, okay, I've never heard of this person, or I've never heard that that would be beneficial. So just continue to follow Royalty Senior Service Consulting on Facebook and YouTube so you can be notified about the various sessions that are taking place every week. Thank you again. And I want to encourage all of you caregivers, let you know you can do it. You can do it. It's not easy all the time, but I'm here to let you know that you can do it. And we are here to help. Thank you, everyone, and have a great day.
Thanks for having me, Tamaria.
Thank you, Emilia.